Hey everyone, it's Top Health Tips here again, and today we're talking about a condition that affects millions around the world. Diabetes. We're going to dive deep into 7 unusual signs of diabetes that you absolutely shouldn't ignore. Early detection is key to managing diabetes effectively and preventing serious complications. Now when we think about diabetes, we often picture the typical signs like frequent urination, excessive thirst, and unexplained weight changes. But diabetes can manifest in surprising ways, often mimicking symptoms of other common ailments. In this video, we're going to break down 7 of these unusual signs, explaining what causes them and why they warrant your attention. So if you're ready to become more informed about your well-being and learn how to spot these often overlooked warning signs, then keep watching. Let's talk about fatigue. We all experience tiredness, especially in our busy lives. But unusual fatigue is persistent, unexplained exhaustion that doesn't go away with rest. Why is this a sign of diabetes? It's about how our bodies use glucose, the fuel for our cells. Diabetes affects insulin, which lets glucose enter cells. Without insulin, glucose builds up in the bloodstream, starving cells of energy. Persistent fatigue with other symptoms shouldn't be ignored. If you're experiencing unusual fatigue, reach out to your doctor. Moving on to our next unusual sign, blurred vision. Our vision is precious, and any sudden changes should never be taken lightly. Blurred vision can be an early warning sign of diabetes due to fluctuating blood sugar levels. High blood sugar can damage the tiny blood vessels in the retina, leading to fluid leakage and swelling. This distorts your vision, like a camera lens with a sticky film. Early detection can make these changes reversible with proper blood sugar management. If left untreated, it can lead to serious conditions like diabetic retinopathy. If you experience sudden blurring, schedule an appointment with your eye doctor. Let's talk about another unusual sign that might surprise you: slow healing wounds. When you have diabetes, even small wounds can become a cause for concern. High blood sugar levels can stiffen blood vessels, making it harder for blood, which carries oxygen and nutrients essential for healing, to reach the injured tissues. Without proper blood flow, wounds are deprived of the vital resources they need to repair themselves effectively. High blood sugar creates a breeding ground for bacteria. Bacteria thrive in sugary environments. This increased bacterial growth can lead to infections that further delay the healing process. If you notice that even minor cuts and scrapes seem to linger longer than usual, or if they show signs of infection, it's crucial to take it seriously, especially if you have other risk factors for diabetes. Now we know many people might welcome weight loss, but when it's sudden and unexplained, it's never a good sign. It can be a red flag for several health conditions, including diabetes. While it's true that type 2 diabetes is often linked to obesity, unexplained weight loss can occur, particularly in the early stages of type 1 diabetes, or in individuals with type 2 who are experiencing severe insulin deficiency. When your body either doesn't produce enough insulin or your cells become resistant to it, glucose can't enter the cells efficiently. To compensate for this energy deficit, your body goes into survival mode and starts breaking down stored fat and muscle for fuel. This process, known as catabolism, leads to weight loss, often accompanied by muscle weakness and fatigue. If you notice a significant drop in your weight without any changes to your diet or exercise routine, it's crucial to consult your doctor. Let's talk about another often overlooked sign of diabetes: frequent infections. If you find yourself battling infections more frequently than usual, it could be a sign that your blood sugar is out of whack. High blood sugar weakens your body's natural defenses. High blood sugar creates a perfect breeding ground for harmful microbes, making it easier for them to multiply and cause infections. High blood sugar also impairs the function of your white blood cells, the brave soldiers of your immune system that fight off infections. This increased susceptibility to infections can manifest in various ways, such as frequent skin infections, urinary tract infections, yeast infections, or even more serious infections like pneumonia or gum disease. Now let's discuss a visual sign that can sometimes indicate diabetes: dark patches on the skin. These patches, known medically as acanthosis nigricans, often appear in areas where skin rubs together, such as the back of the neck, armpits, groin, elbows, and knees. They might feel velvety or rough to the touch and can sometimes be itchy. When your cells become resistant to insulin, your pancreas goes into overdrive, pumping out more and more insulin to try and lower your blood sugar levels. This excess insulin circulating in your bloodstream can sometimes stimulate the overproduction of skin cells, particularly cells called melanocytes, which produce pigment. If you notice these dark patches on your skin, especially if you have other risk factors like obesity or a family history of diabetes, it's crucial to consult your doctor. Our final unusual sign is a bit more specific but equally important: tingling or numbness, particularly in your hands and feet. This sensation, known as diabetic neuropathy, is a common complication of diabetes, and it occurs due to nerve damage caused by prolonged exposure to high blood sugar. High blood sugar disrupts the smooth flow of signals, leading to tingling, numbness, pain, or even a burning sensation. Diabetic neuropathy typically affects the longest nerves first, which is why the tingling or numbness often starts in the extremities, like your toes and fingers, and gradually progresses upward. In the early stages, you might just feel a pins and needles sensation or a slight numbness, but as the condition progresses, it can lead to more severe symptoms like sharp pain, muscle weakness, balance problems, and even difficulty with fine motor skills. Early detection and management are crucial to slowing the progression of neuropathy and preventing complications. So there you have it. Those are 7 unusual signs of diabetes that you should never ignore. Remember, early detection is key when it comes to managing diabetes and preventing complications. If you experience any of these signs, even if they seem minor, don't hesitate to reach out to your healthcare provider. Taking control of your health starts with awareness. If you found this video helpful, don't forget to give it a thumbs up and subscribe to the Top Health Tips channel for more informative videos on health and wellness. And as always, thanks for watching.